عليكم ورحمة الله وبركاته. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Hello everyone, my name is Asna Rizwan, and on behalf of the Hyderabad Association of Central PA, I want to thank you all for joining us on your Sunday evening. I know that everyone has a very busy week coming up with preparing for Ramadan, so I want to thank you for that. Our seminar today, Safeguarding Our Mental Health, we're going to be focusing on our mental well-being with the new reality that we're facing with the pandemic and the recent tragedies that we hear of in the media pretty much every day. This issue is more important than ever to discuss in our community. And hopefully today's seminar, it'll give you a little bit of an insight on how to maintain your mental health and maybe give you a list of local resources that you can access if you need. So today we will hear from 3 mental health experts from our community, Dr. Salman Majid, Sister Durriya Nazli, and Sister Samia Malik. And towards the end, you will have the opportunity to ask any questions that you might have during our Q&A session. We're going to leave that to the end. And if you do need to submit a question, please message me privately on Zoom. My name is Asna Rizwan, just so that questions can remain anonymous. And with that, I think we can start with our first speaker, Dr. Salman Majid. A little bit about him. He is a board-certified adult, child, and adolescent psychiatrist. He completed a psychiatry residency at the Drexel University College of Medicine. And during his residency, he completed a fellowship at the Psychoanalytic Center of Philadelphia and a fellowship at Brown University. And for the last 4 years, he has provided inpatient clinical services at Pennsylvania Psychiatric Institute. He's a clinical assistant professor of psychiatry at the Penn State Hershey Medical Center, and he currently practices at a solo private practice at Silver Lining Health and Wellness. So Dr. Majeed, the floor is for you. I think you're on mute.
Dr. Salman Majid, can you unmute yourself?
Rizwan bhai.
Thank you. It worked.
Okay.
I think it was the message of host muting all I got in the middle of that. Thank you so much, everyone, for joining us. And thank you to the organizers for bringing us together on this important and crucial time. I think that majority people are aware of the recent tragic events, and we're not going in length to discuss those processes or what happened in Texas, but we are more focused on opening up the door, opening up the communication within our community here locally, And for those who have questions, we want to address them. And this is more to facilitate that conversation within our community, within our families. And historically, we as a community are not as comfortable with mental health or mental health treatments or reaching out. Um, Majority of us are immigrants and our kids are here, and back home, the concept of mental health or all of those solutions was not as prevalent. So it is not to blame our community members or in any way, shape or form, say anything negative, but more so that we are also looking inside and raising more awareness, because these are real, genuine problems. Now, this problem with um, mental health awareness is global. It's not only within our community, but it is also um, present in dominant cultures, in Caucasian culture here or worldwide. The crisis is increasing day by day. So worldwide, there are 800,000 suicides every year. So that's a pandemic. And with this COVID hitting us, that pandemic has increased. Now, many of our there is a disconnect between the generations as well. And there is an alarming rate of increase in younger people, in youth, and that is also worldwide. Um, that the rate of increase in younger population, starting from as young as 11 years old, that there has been threefold increase in these incidents. And our community, just like any other medical problem, we are not immune to developing any medical problem just because we belong to this community. Um, Faith and religion definitely helps us from a lot, but then there are medical problems. Just because we are Muslims, it's not that COVID is not going to get us, or we are not going to have a heart attack, or we're not going to have other medical problems. So similar to that, just because we are Muslims, it's not guaranteed that we are not going to develop depression, or we are not going to develop more serious other mental health problems. So, but in our community, generally, there is more shame and things stay more and more closed. We feel significant element of being exposed, so to say. And also, being a small community and minority, we also worry that if everybody would know our business, our kids worry about that a lot more. And that's why there is silence on these uh, very crucial areas of life. And I was actually discussing with two other psychiatrists. I make these educational YouTube videos. I'll be posting that interview later. So we were talking about this gap between the generations, particularly in our Desi community. And older generation, there is we got trained for subjects that we never use in life. We read algebra, we read poetry, or all of those things were part of curriculum that we never use in life. But parenting or mental health was never a topic. So there is a disconnect. All we know about these things is from our individual experiences, and our kids do not share the same experiences. They have a very different view on things, or very different way of growing up. So um, and just because something did not bother us, something did not affect us growing up, or we had it worse, that invalidates when we reach out to, when our kid reaches out to us for some sort of pain. So because being immigrant, we have seen a lot of hardships and sufferings, and our kids might understand that or not, but that's not their problem, what we went through or not. So when they are bringing up their problems, we are quick to dismiss. And I'm not saying in any particular context. It's a general statement that because of our individual experiences and what we have seen in our lifetime, our kids have not. So there's a disconnect that what we see as a real pain or suffering versus what our kids see. Now, for mental health, it is all unseen. So we can't see. So what your child might be going through, you won't see it, just like a physical health problem. So what we tell ourselves when we are lying down in the bed, and that inner message, or what we are reviewing the day, that is different. And I'm not saying all our kids are having a negative dialogue or are hard on themselves. No, we have significant youth thriving and doing really well, and that is great. The problem is when we are missing for those where these problems are happening. They're lying down in the bed, being hard on themselves, feeling an outcast when they are out of home, and feeling that culture at home is not the same. We have two different personalities or personas or identification. So their identification is a key concept that when they are associating with the dominant race here, or what they're exposed to, there's a significant difference. And some might have really great experience and might be having an awesome time, and that is awesome. But just like raising awareness about other medical problems doesn't mean everybody's experiencing it, but just keep an eye. We should be getting a real picture into our kids' mental health, what is going through their mind. Now, with COVID and all this past year, the tablet screen time has increased significantly. Kids are spending more and more time on the screens, video games. A lot of their interactions are happening outside of our control because we are busy, or we are doing our things or whatnot. So it's important that we find out a time where we could sit with them and understand them. And when they say something is bothering them, let's not go with, it shouldn't bother you. It's not a big deal. If they are bringing it up, listen to them, ask them, or see how they're looking at that situation, and then see how much it is bothering them. If it is small thing, then all right, move on to the next and see, basically get a good grasp of whether they're hurting or not, because that silence is dangerous. And this, because of this unseen picture, and many of our kids being perfectionist and being hard on themselves, the small things that we say, they could take it really to the heart. So particularly things like comparing one child to the other, be it in the family or outside. It's very common. We are success driven community. We want everybody to succeed, do their best. That is great. That makes us successful. But if your child is already hard on themselves, and then we say, why that, why, my friend's kids, or you're that classmate, why his grades are better than yours? So that kind of conversation, maybe when you need to motivate, that is fine. But I think as a community in general, it's not only specific to Muslims. In our Desi community, all of it, if our kid is not first, we are going to say, well, why? Well, you're not first, so that other kid is. So that comparison invalidates their experience. So understand their experience, validate that this is what they're going through. And if you feel that your child is in pain, if you understand that, or pick that, then open up more communication and conversation. Now, we as a society or community also, we decide more for our kids. So this conversation with other psychiatrists, I think one question was whether we view our kids as extension of ourselves. Are they more individual beings or are they part of us? And that is an important conversation to have. And in back home, we grew up in a collectivist community, in a where more it is together, everything is more collective. Here we are in an individualist community, and our kids are growing up in that. So for them, many kids feel even our concern to be sometimes reaching the point of intrusiveness, or we are controlling too much. So balancing it out, and again, it is case by case. If you're not taking interest, of course, you need to take interest. But if it is too much and kids are not making their own decisions, then you need to let them make mistakes, let them fail, let them learn from that. So, but if you see, so being seen is an important part in our community and for our kids. But and if you see that your kid is suffering, you open up the communication. If it resolves, great. If it doesn't, and you feel that they are in a lot of emotional pain, then definitely reach out for professional help. I think one of the things that also from my part is many people for psychiatry worry that when they reach out, we are just going to push pills. And that's not only in our community, other Caucasians or other ethnicities worry about that too. But that's not what treatments are. That is one of the treatment, and very effective if there is a biological shortage of serotonin or certain chemical imbalance, then they're very effective. And but there is therapy, there are other working on those family dynamics, working on understanding each other. Those things are very effective as well. um, and more, we don't know all the youth that is drifting towards these artificial means of substance. That is very common in general in the community. So if they're reaching out to those things and we are saying no, we don't want to mental health treatment medications, then that is not uh, that's not balancing out. So we definitely need to reduce the shame. And sometimes it could be many people when we meet, sometimes it is a 1 or 2 time conversation. So it's not, there is a myth that people would just stay, once they reach out, they would just stay in the treatment forever. That's not the case. It's case by case. There are some, like, for example, diabetes patient is going to need care for lifetime. For now, what treatments we have, it's management. So there are some treatments that require management, but there are some that just require shorter, briefer intervention. But if safety is an issue, then definitely reach out. For our youth, and I think that's where one of the thing in this person from Texas, his letter, um, that he could not feel happy. And so happiness is not the purpose of life. Happiness is more of a side product. We are not just living to pursue happiness. And that's where there is a difference in hedonism, where you're just pursuing pleasure. That's not the goal of life. The goal of life is you're finding your purpose, exploring, figuring out. And for youth who is figuring out identity, it is, which is a major theme, because that is theme of adolescence and young adulthood, to figure out their identity. We all went through that. Who are we? What's our purpose? And I think this, in this incidence, of course, where what tragedy happened, that person couldn't find that. But I think that's finding that purpose is the purpose in your adolescence or youth years. And of course, there is love, exploration, helping others. There are so many other goals, serving God, prayers. There are so many other goals that we could go more into, but we don't have time. But happiness that this person felt couldn't feel was not the only thing. And of course, if people have more question about that, we could go more. That we were cautious in this particular conversation. Our goal is to more open up the communication for everybody and reduce the shame and stigma of mental health, and um, connect through the generations, understand our understanding might be different, reach the kids where they are and validate. If you could work, and for some time it could be involving another family member. But if you involve any family member, any relative, neighbor, or even professional, don't do it without child's consent. Ask them if they're okay with that. If they're not, then of course, if it is safety involved, then you could bypass that and be like, well, I'm concerned about your safety. We have to do it even if you don't want to. But if safety is not, their life is not at threat, then do not just talk to other people without their permission. That's also a very common theme in our community, because we seek counsel from our relatives, loved ones in general, that what should we do? But our kids don't like that. That shuts them down further because they think that their business should be discussed with everybody. So that was the brief overview, and definitely I think we'll go more over the questions. Thank you so much for the opportunity.
Thank you, Dr. Majeed. Our next speaker is going to be Sister Durriya Nazli. And a little bit about her. She has a master's degree in clinical psychology, and she works as a mental health therapist at TW Panessa and Associates Counseling Services in Harrisburg. She enjoys working with children and adult women and is currently working towards obtaining her licensure in counseling. So Durriya Auntie.
Thank you, Asna. Assalamu alaikum wa rahmatullahi wa barakatuhu, everybody. I would like to start by exalting and glorifying Allah subhanahu wa ta'ala, who has made today's gathering possible. Subhanallahi wa bihamdihi, adada khalqihi wa rida nafsihi, wa zinata arshihi wa midada kalimatihi. And by making an earnest dua that what I have to tell you today is useful to our community. I also want to thank the organizers for taking the initiative to organize today's event and for giving me an opportunity to speak to you all. So let's take a look at one of the subjects that we did learn in school, which was poetry. So more than 200 years ago, a famous poet said, "I walked a mile with pleasure, she chatted all the way, but left me none the wiser for all she had to say. I walked a mile with sorrow and never a word said she, but oh, the things I learned from her when sorrow walked with me." So these lines tell us that most of our life's greatest lessons come from sadness, come from sorrow, come from tragedy. Right? And it is with this hope that the tragic events of the last few weeks will teach us important lessons that all of us can stay with. It is with this hope, really, that today's event has been organized. And these lines also bring me to the first message that I would like to convey to all of you, which is that depression and sadness are two different things. So the topic that I'm going to cover firstly is how to recognize that what your family or what your child or what you yourself are going through is more than just sadness. Someone said that sadness is like a head cold. With patience, it passes. But depression is more like cancer. So this should give you an idea about how intense and how painful the experience of clinical depression is for the person who's going through it. Sadness is an emotion. All of us have felt it. All of us have experienced it. It is what makes us human. It is what makes our joys even more remarkable. But depression is not the same as sadness. It is a mental illness. And for it to be diagnosed as clinical depression, here are the things that psychiatrists and therapists look for. For at least 2 weeks of time, at least 5 of these things need to be visible need to be experienced and seen in someone for it to be clinical depression. Depressed mood, which is sadness, and along with sadness, there also needs to be a diminished interest in doing things. So for instance, a mother who previously really enjoyed spending time with her kids doesn't seem interested in her kids anymore. Or, a student who used to love extracurricular activities wants to just stay home. So look for changes like that. Along with this diminished interest, there's also generally a significant weight loss or weight gain and an increase or decrease in appetite. So that's something else that we we need to look for. Very often there's also a kind of slowness or sluggishness to the way a person thinks and moves and does his daily activities. Fatigue, loss of energy is another defining feature, and something again that sets apart depression from sadness is that the person begins to feel very badly about himself. There are feelings of worthlessness, there's inappropriate guilt that people experience. For instance, again, talking about a mother, her children are going to school, they're doing well, but she feels very guilty about herself as a mom. Teenagers feel that there's something wrong with them, that they don't fit in. This could be a feature of depression and not just sadness. And of course, we have, problems with concentration, with thinking, and then what has become pretty famous, recurrent suicidal ideations or thoughts about death. So, when we have certain life experiences, like maybe you haven't done well on a job interview, or you haven't gotten into the school that you applied in, or you just lost a pet, or you've been through a divorce, you go through sadness, right? And the sadness can go on for a few days or even a few weeks. But what differentiates it from depression is that when you're going through sadness, you're also able to experience moments of joy. You can crack a joke, you can laugh at a joke, you go about your daily activities, but not so when somebody is clinically depressed. It affects different areas of their life, different aspects of their life. So that's how you would be looking out for depression. Okay, now let's assume that we have recognized depression and we want to know what to do about it. Asna, okay. So and most of this was covered already by Dr. Majeed, and I will just add a few things here. Open up the channels of communication with whoever it is that you're noticing depression in. And I don't only mean children, it could be spouses, it could be parents, siblings, it could be anyone in the family. And so what does a depressed person need from his or her family? Now, most depressed people will agree that what makes depression really, the worst part of depression is the feeling of isolation. It's the stigma, it's the shame, it's the feeling of otherness that's associated with it. So anything that you can do to communicate to the person that you see that they are in pain and that you are there for them, is what the person is looking for. So as parents, being more attuned to your child, and by attunement, I mean being present with your child completely, without your cell phone, without any other agendas, with an open body posture, with a non-judgmental attitude, just inviting them into a conversation. Very simple things like, I've noticed that, since you failed the test, you haven't been yourself. You didn't enjoy the biryani I made yesterday. Do you want to have a conversation? So something as simple as that can open up your child or not, right? They might give you very curt and rude responses. They might say, I don't know what you're talking about, or I don't feel like it. Here's where, we've got to resist the temptation to kind of become children ourselves. We've got to stay as the parents and as adults, because what a person, especially a child going through depression, needs is the knowledge that there is a stable, relaxed, mature adult who's looking out for him. So if you can give that message to your child, by staying calm yourself, by staying in control yourself, by not regressing and getting angry or, using things like, but I'm your, how dare you talk back to me? Or did you know how hard it was for us growing up? Or just snap out of it, or, this is just a phase, it's your hormones, it's your friends talking, it's not you. I think we've got to stay away from language like that, which can only make it worse for the child. And of course, we have, Asna, can we go back to the previous slide? And of course, in the Muslim community, we have a lot of myths about going to therapy, right? Many of us feel that therapy is no good. Going to therapy and seeking help means that we don't have enough faith in Allah, that we are weak people, and that we should not go out and wash our dirty linen in public, right? So I would like these myths to be busted, and for us to know that clinical depression is not about not having faith in Allah Ta'ala. Like Dr. Majeed already said, there are so many things that are involved in it. There are chemical imbalances, genetics plays a big role. Even big life changes can sometimes trigger depression. So like he said, again, we've moved from country to country, most of us, the immigrant community. We have gone through, things that we possibly look at as more severe or more, huge and dramatic than our children. But they don't know that, right? Their reality is in this country, and it's relative to the experiences that they have had. So not putting away this myth that it's about weakness of character or lack of faith, I think will go a long way in maintaining mental health. There are all sorts of myths about therapy, but I can only say that for one to really experience the benefits of therapy, you will need to go through that experience where with a good therapist, you can really find a relationship where there's no judgment at all. There's a lot of acceptance. There is empathy. And that relationship itself becomes a conduit, becomes a channel through which great change is achieved within that individual. So it's sort of, in fact, we are a religious community, right? And when we go to Allah subhanahu wa ta'ala, that's what becomes redemptive for us, right? The fact that Allah Ta'ala can accept us the way we are and accept our apologies and accept, He knows us for what we are and still is there for us. So that's happening on a very human, I think the best possible human similarity would be in the realm of therapy. Okay, having spoken a little bit about, I'm happy to answer any more questions that you might have about therapy. But going on, I would like to just share a few things that we can do within our families to develop and maintain and safeguard mental health. One, we have already spoken of: address the depression, do not dismiss it. Be attuned to your child and be relaxed yourself, because children can say, a lot of kids who come into for therapy, they bring their issues to the therapist's office because for various reasons. Of course, they feel judged by their parents, but sometimes children want to protect their parents. They feel that their parents are already very stressed out, and they don't want to add to that stress by telling them about their suicidal ideations or whatever else they're going through. The other thing that I would really like to encourage is to honor feelings within our families, to create an environment where we feel safe talking about our feelings to each other. A great way to do this might be, at our dinner tables every night. Make it a habit to have dinner together and talk to each other about the day, about your respective days. And include feelings into that. So what made you happiest today? Did you have an embarrassing moment? Throw yourself into the conversation too. Another thing that children really like is when parents share their own stories of vulnerability. Right? Not just of strength, but also of vulnerability. Recently, I had a child say that, when he shared his suicidal ideations with an adult, what brought him the greatest comfort was that the adult had gone through it herself. And that gave him hope that he could get through it himself as well. Going outside, physical exercise is a great way to, bolster mood, to improve your mood, and also to build, sort of to strengthen those family bonds. Now we live in Pennsylvania, we have 6 months of winter, but let's make the most of those 6 months that we have sunlight and really go out, because we can really use our bodies to feel better in our minds. And even simple things like eating protein-rich foods can go a long way in maintaining emotional well-being, in maintaining mental health. Then I would like to end with a few other things that you can do within your families to maintain mental health. If you can make little things like deep breathing a part of your daily family life, maybe after every salah, if you can sit for 5 minutes and just breathe deeply, you can see that it has, you can see the effect it has on your sense of well-being. Even the posture, like right now, if you can just lengthen the spine, lengthen the base of your spine and sit up straight, you'll see that it has an impact on your mood. Another thing is orienting yourself visually, using your senses to break out of ruminating, to break out of depressive thoughts. For instance, when you find yourself thinking too much, you can just, or if as parents, if you notice that your children are doing that too much, play a game with them using the senses. Ask them to pick out 5 yellow things in the room, or to identify 4 aromas in the house. Another great activity we have is called layers of sound. So this includes the family sitting together and paying attention to sounds in layers. So you start with, sounds that are furthest off. So, start with, okay, what can you hear outside? What can, you can hear the traffic, or you can hear the neighbor's car, and then slowly come closer and closer. What is it that you can hear inside the house but on a different floor? What is it that you can hear within the room? What is it that you can hear inside of your bodies, right? So this body work is very often used by therapists to enhance mood, to affect your mind. So, and these are little things that you can do in the safety of your home, and these are things that you can, inshallah, incorporate within your family life. So that was it from me. I hope that you found this information useful. So here's to happier families and better emotional health, and wishing you all a very happy Ramadan. Jazakallah khair.
Thank you, Sister Durriya. Our next speaker is Sister Samia Malik. She is an active member of our Central PA community. She has conducted a series of lectures on Islam to several institutions, including the Women's Interfaith Symposium, Messiah Lifeways, and many other groups. She's also served as a board member to the police chief of Silver Springs, and as well as a commissioner on Governor Wolf's Commission on Asian Pacific American Affairs. In addition, she has received the President Award for her work with the group Community Relations with Criminal Justice for developing and conducting sensitivity training to all criminal justice groups, including the police. She was also awarded Peacemaker of the Year Award by the World Affairs Council in 2017. So the floor is now you, Sister Samia.
Sorry, I didn't unmute myself. Bismillah ar-Rahman ar-Rahim wa ala alihi sallallahu alayhi Sayyidina Muhammad wa ala alihi wa ashabihi ajma'in. Assalamu alaikum rahmatullahi barakatuhu. Asna, can you put the backup later at the end? Yeah, that'll be good. Okay. Is mental illness a Western concept? Let's talk about that briefly. Who are our role models? Our prophets, correct? Yes, they are exceptional human beings chosen by Allah subhanahu wa ta'ala. What is their take on mental illness? Let's look at it very briefly. In the Quran, in the Sunnah, in the Quran, in Surah Yusuf, we are told of Prophet Yaqub, who was so sad after he thought he lost his son, Prophet Yusuf, that by suppressing his grief, his eyes turned white. Our beloved Prophet Muhammad sallallahu alaihi wasallam, the year he lost his wife Khadija, his uncle Abu Talib, and went through some political turmoil, faced an intense period of difficulties. Now, historians have called this the year of sadness. A couple of hadiths I want to quote here is, your Lord has a right on you. Yourselves have a right on you. Your families have a right on you. So give each their right. Another one is, seek out cure, O servants of Allah, for God has placed a cure for every illness except old age. Notice the wording. It says every illness, and it gives the exception, and mental illness is not it. It is not just restricted to adults. Once the Prophet ﷺ saw a young boy crying because his pet bird died. Now remember his position and his responsibilities. Did he ignore or dismiss this little boy? Absolutely not. He stopped and consoled the little boy and asked the boy to talk to him about his pet bird. After the death of our beloved Prophet, Sayyidina Aisha, among her many accomplishments, has also practiced medicine. She would make talbina, a soup, to give to people experiencing anxiety, depression, and bereavement-induced psychosis. The Prophet said, talbina makes the heart cope with sorrows and grief and helps it to find rest. Every morning, our Prophet's morning dua was that when he started was, "Oh Allah, I seek refuge from worry and grief." When our beloved Prophet prayed against this every morning, how can we say that Islam does not acknowledge mental health? Think about that. Now let's look at our history. Can you guess where and when the first mental hospital was built? It was built in Baghdad in the year 803, 1,000 years ago during the time of Khulafa Harun al-Rashid. What comes to your mind when we mention mental hospitals? Usually one thinks prison-like conditions, patients in straitjackets. Well, let me describe the Muslim-run mental hospitals of that era that may have been in the dark ages for Europe, but the golden age for Islam. The hospitals were called Bimaristan or Dar al-Shifa. They were in the center of town in the masjid campuses. So it is accessible for people to visit their family members with beautiful gardens and fountains. The patients were treated with dignity. They had their own space and their own say in their treatments. If they were severely ill, the courts appointed a guardian for them. They were treated in holistic ways. Muslims used compound drugs 1,000 years ago, stimulants, sedatives, suppressants, and antidepressants, which were called muharrininun nafs, meaning gladdener of spirits. They used alternative treatments like bloodletting, cupping, auditory treatments like listening to the Quran, bird songs, water sounds, aromatherapy using oils, pomegranate, henna, and mystic leaves, massage therapy, healthy diets, and good sleep habits, all Islamic concepts. When a person was well enough to leave, they were given monetary help to get them restarted in life. How were these places financed? Zakat money was used, and also by waqfs or endowments of the well-to-do, because of the belief taking care of the sick and the destitute was their Islamic duty and was pleasing to Allah subhanahu wa ta'ala. One gentleman called Atif Walid made an endowment to hire only the best chefs to cook healthy meals. Others made it to hire only the kindest people to work at these hospitals. An important point to remember here is that it was open to all, Muslims and non-Muslims alike. The Doctors visited the patients every day, conducted research, and trained the next generation of practitioners of all faiths. There were similar hospitals known as Darul Miristan, Fustat, Nuruddin, Maisoni, Nasri, and Undburg in Baghdad, Cairo, Damascus, and Turkey. There were many great scholars of psychology in that era, including Ibn Sina, Ar-Razi, and many others. The most famous among them was Abu Zaid al-Balkhi. He was a polymath. A polymath excels at many different things. Although his super specialty was geography, he established al-Balkhi School of Geography. He was an expert in psychology also. He established that mental health can be determined by environment or biological. He recognized anxiety, panic attack, and OCD. In fact, he may be the first person to treat OCD as a disorder. So, how can we deny mental health? Do these issues exist far away from us so we don't need to worry? My dear family, let me tell you, all these issues, depression, anxiety, panic attacks, addiction, suicidal thoughts, OCD, anger issues, cutting of oneself, postpartum depression, elderly depression, murder suicide, attempts of murdering family have happened right here within 15 miles of where we all live in the past 15 years or so. Please keep these families in your du'as. We ask Allah to make it easy for them. It is a test from Allah subhanahu wa ta'ala. It may be a lesson for us. Only Allah subhanahu wa ta'ala has the right to judge. In conclusion, my advice, keep Deen in the center of our lives and be connected to the masajids. The purpose of our lives is to worship Allah subhanahu wa ta'ala. Yes, by salah, qiyam, and siyam, by also serving Allah's creation. Please, as families, go to the food banks, soup kitchens, the homeless, the elderly, and help with organizations like ICNA Relief and others. There is always someone who can use your help. Be involved in your communities. Lead by example. Yes, mental illness is real. It can happen to anyone, and keeping the faith alone is not always sufficient. We have to seek professional help when needed and follow the advice of the experts without being shamed. Let us shed the stigma attached to mental illness. We have no choice anymore. Walhamdulillahi Rabbil Alameen. Jazakallah khairan. Assalamu alaikum. Here are some of the resources that might help you in the future in case you're seeking for some help. Next slide. And we can move on, Asna.
Okay, thank you, Sister Samia. It was really informative. And just to be mindful of time, we're going to start our question and answer session. So you can submit a question through the Zoom chat function. Just privately message me with your question. And our first question is for Dr. Majeed. Can you cover screen time and how it impacts one's brain and how to control that time without creating an argument in the family?
That's a good one, particularly because I mentioned generational difference, and I think this is the one probably very commonly discussed or brought up. So it varies from different age to different age. So right now, even our infants know, 1-year-old know how to just swipe and get to the apps and click on the videos. And American Academy of Pediatrics recommends no screen time below 2 years of age at current recommendations. I think it might change with the speed that technology is changing. And for above 2 to 12, it is 2 hours a day. And I think that is difficult to sustain because many of these recommendations came even before this screen, the touch screens and the phones and tablets were available. So we don't have any most recent recommendation, but on school days, I think that 2 to 3 hours for below 12 is within reasonable range. Of course, you have to see your other activities. Another thing to also look at is what are the other activities that are being done. And nowadays, many of the school itself is on Zoom. That itself takes 6 hours or so. So that wouldn't count in that screen time as well. So also, I think that there is need for revising many of those recommendations. It also depends what is being done on the screen. So there are many addictive behaviors, these video games that one continues to play. That also, once you play beyond 3-4 hours, usually you will find yourself more agitated, more easily irritated because it's draining. It's a dopamine system. So when we win a video game, that's why we are playing. That's how they're designed. They're designed from very simple to continue the complexity level. And anybody will be, even little child, when they start, they are going to win till they continue reaching the next level. So there's a release of dopamine with every win. And then after 3 or 4 hours of continuing to do that, there's depletion, and the effect is more agitation and irritability. So there's need for more regular schedules. And I'm not saying which family should do what, particularly while with COVID, both of us parents in my home working, our kids are using more screen time than what I told you as well, because we don't have other engagements. But what we try to do is add more educational activities, limit the video game time, so change the different activities that are being done. Also use them as reward later. So all of this needs to be discussed openly within the family, and some rules and guidelines need to be placed. Parents, once they have discussed, it should be a collaborative discussion. What would be a reasonable time? Now, bedtime is important. At bedtime, it has to be taken away. And if a child is not leaving, because sleep is very important for your growth and development, particularly for our youth kids. Your brain is developing, your body, your hormonal system, all of that regulation. Like just like your electronics are charging, their charging is, if they're not charged, they're not going to function. Similar way, your brain, sleep is its charging. So make sure that it is not being used at bedtime. You could discuss with your friends, make a plan for maybe wake up after Fajr. There is still time. If you wake up as a reward, you could play half an hour at that time, rather than if that works with your school schedule. So and parents also, in terms of understanding, there is need to continue to monitor what is being done. There are many parenting control apps, so that needs to be used. And I think as parents, our next generation is more ahead in how these different controls and technology work, so we get their help. But we need to educate ourselves, be aware what they're using. For YouTube, there are many, for younger kids, there are many ads, or there are many things that are playing that are not appropriate for little kids. So make sure that you are continuously observing seeing their history, seeing what they're exposed to, and then having this ongoing conversation. If it is impacting their grades or other day-to-day activities, that means it's too much already. So that was a long answer, but it is a very complex area. And also in understanding them, that could also be a conversation that at times we could be annoyed, but you could also see that could also be an into their brain or what they're doing. They will feel excited talking about it. That could be opening up the communication. Coding and other things, there's a lot of future there. So make sure they're utilizing these things in a productive and constructive way.
Our next question is, how do we get help and treatment to a patient who is in denial and refuses treatment?
So right. So if there is no safety concern, you cannot force anybody. It's a voluntary treatment. So person has to be willing. You could let them know that it would help, but you cannot force. You could encourage, you could let them know that there is help available. And again, it probably depends from situation to situation. So for parents, it might be easier to have that discussion than spouses. So, or I think in our culture, same thing, that we don't seek couples counseling. We might break up, but we are not going to see couples counseling because of that same shame or those different elements. Um, but the only thing you could do is voluntarily engage, let them know. So if another thing, for if somebody is not changing, one quick strategy is just lay out a little bit of what would happen if there is no change. So lay out a year or 5 years. Like if you continue this way, what's the outcome a year from now? What are the things that you're actually going to lose financially, relationship wise, your peace of mind? What are the things? If nothing changes, nothing changes. So you could have those conversations, but in the end, the person, it is, if you force for anybody against their will, the likelihood of failing the treatment is very high. So convince.
Our next question is, Assalamu alaikum. Given this change in mode of education with virtual academy and such kids aren't getting the attention they used to get from their teachers, and an otherwise great performing kid could be struggling with their grades and feeling a bit depressed these days, what's the right way to handle these situations and how to instill confidence in them?
So right, I think that this was a difficult year, and um, and opening up the communication, just continuing to check yourself, um, and I think that keeping that communication with teachers as well. There are a lot of these apps, learning apps, and Khan Academy is another very good resource that I usually tell people or use for my own kids as well. You could make a parent account there, and that's independent of the school grade. Even if the child is behind, they would. So Khan Academy is a free resource for us. There has been big money spent on that, but so similar to that, there are other resources available where you could track your child's progress, and then instead of their screen time being on the video games, just have them that discipline that you have to sit and study for this many hours, keep an eye on the grades, have that ongoing discussion. One problem is sometimes we have these discussions quarterly or after the report card, and they're intense, if particularly if grades are not where they need to be. So instead of having that quarterly, make sure that it's more regular check, weekly or bi-weekly. Just keep an eye, particularly if things are not going well, so that those quarterly things are not a surprise. And of course, let them know, because again, balancing where they are, where child is, keep that open communication that they should continue reaching out and having that discussion, but it should be clear to the child it is for them. Many times they don't see this is for them, they see it, we are doing it for us.
Thank you. We can probably take maybe one or two questions, but if you have to leave, just ask about Karen for attending. For Sister Samia, I've heard we have elderly in our community that are alone. What can we do to help them? Should we make a group or visit them to give them company? I think you're muted.
Assalamu alaikum. That is something that is very doable and can be done right away. We can make a list and make a WhatsApp group of sisters, and brothers can do for brothers, or I don't mind doing for both. Connect people. connect people and make a schedule to call our elderly once a week, um, whatever your schedule allows you to do. And, and even during summer, our youth can go and help them with odd jobs, doing their lawns, putting the trash out. You know how difficult it is for some older people to just push the trash containers out. So there's many things we can do. It's very doable. We can start that right away, connecting elders to the young ones who are willing to work with this. Jazakallah khairan for that good question.
And for our last question for Sister Durriya, most of us think that teenagers will behave in certain ways and eventually they will come out of that state. What are some of the signs we can look for that indicate deeper issues in addition to the one you mentioned?
Asna, is that question also typed out? I'm not able to hear your voice
Me
clearly.
too.
Okay, I can read that. Most of us, thank you. Most of us think that teenagers will behave in certain ways and eventually they will come out of the state. What are some of the signs we can look for that indicate deeper issues in addition to the one you mentioned? This is for Dr. Salman, but do you want to answer it, Dr. Majeed, or?
I can't sorry, I missed, is it?
It's the, okay, Asna, you've sent that message to me. All right, I'll answer that question. That message was sent in private to me. So what are some of the signs we can look for that indicate deeper issues? One of them certainly is silence, refusal to, having long periods of silence and non-communication is a definite sign to look for. And changes in you as the parent knows, what constitutes, the regular personality of your child. So anything that is markedly different from their regular pattern, including things like, disrupted sleep patterns, changes in their appetite, in their interests and hobbies. So things like that can really ring alarm bells for you and can be red flags.
Dr. Majid, did you want to address that question as well?
Thank you. Yes, I totally agree that it's, if we are spending more regular time together, that change, you're looking for change. If there is more withdrawal, more isolation, not opening up, that is where I would say a concern. Grades could be a sign that if somebody was brilliant, performing well, and now their grades dropped, that would be another concern that we could look for. Sometimes it could show, for little kids, it could show with more clinginess. All of a sudden they become more clingy, and sometimes it shows with disruptive behaviors where child becomes more disruptive and starts to act out while they were not doing that before. And instead of looking at more punitive and style or punishment, probably I would say go with what's bothering you, what is happening. Let's work on that. So that will be something. So the term we use for isolation, withdrawal, inward, and not sharing, that's called internalizing. Person is internalizing. The other one where child is acting out, being more volatile, aggressive, that's called externalizing or acting out. So now they're letting their emotions out in a strong way. So the first one gets ignored and remains silent. The second one, externalizing, gets more punishment. So just watch out for both. And for either change, just express that you are there for them and you will support. And of course, parents' love is unconditional. It's there whether they behave or not. So just make sure that you're using that love language with them for expressing either. Of course, if you have to give consequence, then you could still give consequence for some behavior that they did. while still expressing your love and concern, but opening up the communication is the key. I'm also, I mentioned that YouTube video where I discussed that generational gap and parenting with two other psychiatrists. They're similar to me from Pakistan and now practicing here in different states. So that I'm just adding that link in the chat message.
Thank you all for your questions. Could each of our speakers share how, if someone has a question, they can reach out to you?
You could email. I'll add my email in the chat message.
I just put out my email in a chat box to everyone. It has my name and my email ID. That's nazli.durriya@gmail.com. Please give me a couple of days to get back to you because it might take me a few days.
Same here. And if you don't hear, please, it's not because it's most likely because I just missed it. So you could feel free to repeat that or send it over again. Sometimes schedule gets busy, but I have, the email is here. Organizers have done really great job. And I think reaching out, if you don't hear directly, of course, you could still reach out through them. They know how to get to us.
And Sister Samia?
I am trying. My email address is SAMALIK1, Sam Malik 1@AOL.com, or my number is 717-580-9244. We also put it out on the slide that Asna shared. So please reach out to me and I'll be happy to help you in any way that we possibly can, inshallah.
We ask Allah to give us strength and sabr during these difficult times. May Allah increase all of our knowledge and be steadfast in applying it. Ameen. And with that, thank you everyone for joining us. And I hope you enjoy the rest of your evening and Ramadan Mubarak.